This is the Philosophy of Nursing assignment for Justin Schroll. One of the first things I always definitely address with one of my principles basically is definitely make time for your patients. And I don't mean that in terms of like, bodily care and things like that. Obviously that's pretty much sometimes muscle memory even. What I mean is like, take care of your patients in terms of like talking to them, making sure they feel comfortable, making sure they build basically a rapport with your patients and help them to trust you. A lot of times, I'll be doing, or I'll just be basically talking to a patient, and they'll either reveal something about their history that might not have been H&P originally, either from the their primary physician or from the physician doing their surgery or at my surgical hospital. So definitely just important to always build up that rapport. Another one is just provide rest whenever there's an opportunity. Anytime a patient's staying in a hospital, having to take vitals every 4 hours, adjust flow rates on either CBI or IV pulls, all of that definitely disturbs the patient at nighttime. So trying to keep the noise and everything to a minimum is definitely important. Lastly, definitely, I try to provide my care as if there is not a higher being. However, that's not saying anything against religion necessarily. I try to still make sure I provide plenty of ability and time for my patients to definitely worship if they feel like there's need to. I have a lot of families that do praying pre and post-operatively just to help with the healing process. And I think that's definitely important. It's just not necessarily for me. So yeah, my pointillism project did not go super well. I tried to do it like a nurse with outstretched arms, taking care of like a patient, with different basically aspects going into and out of the different ideas bouncing off each other. It really didn't come out super well. I am a little bit embarrassed to say how long it took me to do my art project, but a little bit of the explanation there in case you wanted to read that. But the points of color as they pertain to Nightingale, I definitely would have chosen like purple as a symbol of royalty, since she was technically from an upper class family in the British or the British Empire, yeah. And then definitely like another color I would have chosen would have been like green to represent cleanliness, as it pertains to like sanitation, washing the body. Obviously, religion had a big thing to do with her entire, 10 years as a nurse. So like I would have used blue definitely, or like navy blue to convey, I would have used green to convey like a sense of like washing the soul and keeping the air clean, things like that. And then I would use navy blue to convey a sense of like bedding and nighttime, just because rest was definitely an important role to play basically in the soldiers' recovery time and everything like that. So for Watson's theory of practical application, let's see here. We as nurses need to be definitely listening ears for the patient's wants, needs, fears, vulnerabilities, things like that. We also need to present patients like the ability to protect, care, and revitalize our patients by taking them at their most vulnerable state and helping them to rise to care for themselves, retain dignity over time, and then definitely grow possibly spiritually as well as mentally, whatever they're kind of open to. So caritas, I definitely looked up the definition, and it was just basically Christian love, humanity, and charity. My current most recent personal experience with that was being able to care for a patient that had just had a recent thyroidectomy. They had undergone, or they were getting ready to undergo, I believe, a little bit of radiation or chemotherapy as well. And, just listening to them worry about or convey their worries and fears to me, and what that meant for their family and things like that. We both came from different backgrounds, but I have had some small experience with that, both in the caretaker role as well as the person being cared for role. And it was just nice to be able to help and kind of help get rid of some fears that were involved with that as well. So being aware of the mind, body, and spirit. Um, let's see here. Uh, so we're basically already taking care of the body as we have to, whenever we're in nursing. But being able to care for the mind and spirit is a little bit more tricky. Providing rest, obviously, a lot of times helps out with the mind aspect of things as well as the body. But treating the spirit takes a little bit more effort as well. A lot of times I'll make sure that a patient has access to either like the chaplain, or if one of the other nurses wants to go in and pray with them, that always helps out with that as well. I also try to make sure I'm in teaching every time I'm pretty much in the room, since it takes about 7 to 8 times for any lesson to actually sink in. I believe that being aware of like the mind and people's nerves. I want them to be able to take care of themselves when they get home. So repeating myself is sometimes important. The most recent caring moment I had, again, I definitely used my patient last Friday, but one other patient from last Friday as well. Another part of their body had become cancerous, and we were removing kind of a necessary part to procreation, and he was having a little bit of problem with it. So I just made sure, like, to we came from different backgrounds again. Just being able to talk to him, and he had a pretty big family as well. It was just nice to see each other, or see things from each other's point of view. And though we had our differences, our love for our family, and we also had our love for our jobs, and what he had accomplished in his life versus what I'm trying to accomplish. Both of us had basically meeting ground to be able to convey basically love for each other. So it was really neat. Weidenbach's, the first component for reverence to life, I would agree to having a reverence for other people's lives, but as for my own, as well as a lot of nurses in the profession, I do notice we generally have aspects of our lives that aren't certainly in control. For me, it's overeating, but I do see a lot of nurses smoking, drinking, having spousal or relationship problems. I just think that we don't put as much effort into ourselves as we do necessarily into our work, and that can definitely show. The second thing was respect for dignity, worth, autonomy, individuality. I originally came into nursing as a backup to being pre-dental when I couldn't quite get the grades to get into dental school. I didn't recognize basically that there was a lot of care that went into nursing, which you just don't see it on television or anything like that, so I didn't understand. But basically, trying to find good in each patient, and then recognize that each patient had their own collection of experiences, knowledge, and that they were their own human being. Basically, it was always nice to take care of someone new and learn new things about each person. And I definitely found a new respect for each person's worth and them as a human being, even if they might not have had the most stellar of backgrounds in their lifetime, or if they might not have treated their lives as well as they should have. As for the resolution to act personally and professionally held beliefs, my personally held beliefs were mostly Christian and conservative in nature. I try not to push those on anyone, especially I also try to remove any biases during my workplace hours. However, my professional beliefs I try to stick to every day. Those are basically the philosophies I listed above, as well as be approachable, respectful, the whole golden rule, basically treat others as you would want to be treated in that situation. Don't judge, and be supportive, and know when to hold them, when to fold them. What I mean by that is one of my previous teachers basically had said learn when to go to bat for a patient, and also when to fight a patient on a certain subject, in terms of how it relates to their health. So corrections to Henderson's 14 components, I had kind of fun with this. Breathe normally, I would say that's true, except for make sure you have an incentive spirometer and use it to 10 hours, with also pursed lip breathing for COPD patients. Eat and drink adequately unless on a special diet, fluid restriction, or NPO. Eliminate body waste, but not too much CO2. The other two are pretty much normal. Also, she had said select suitable clothes, dress and undress. Not as necessary, or not as necessary with the invention of heating and air conditioning. But at the same time, I also want my patients to be in a clean environment as well. Maintain body temperature within normal range by adjusting clothing, modifying environment. If the patient has a fever, usually fighting infection. Let's see here. Keep the body clean, well groomed, and protect the integument. That is definitely true. I always try to make sure I keep up my 2-hour check-in turns, as that does have pretty bad implications with pressure sores. Avoid dangers in the environment. Basically, do no harm and be cautious. I definitely find that still super viable. Make sure you're always double checking your 5 rights, medication administration, things like that. Communicate with others. Also very important, I try to definitely make sure I vent at home at night without trying to break any kind of HIPAA, but it does definitely help getting patients out of my head a little bit. Worship according to one's faith, I think that's super important, especially for the healing process. And then also work in such a way that there's a sense of accomplishment, take pride in your work, basically. I absolutely agree with that. I think nurses should definitely do that more often. Work in a sense, play or participate in various forms of recreation. I would not really agree with that at work. I don't think you should definitely be doing that while you're on the job. And then also learn, discover, satisfy any curiosity that leads to normal development, health and use available health facilities. Yeah, I would definitely say that kind of it's not really viable these days as much as it used to be necessarily. I try to, if I have a question or something like that, I'll ask someone across from me. But for the most part, I just definitely stick to Google and then also the physicians if I have any, if I need to learn something. So what I would have changed is like the eat, drink adequately, eliminate body waste, and that I think those should be definitely revised. And then select suitable clothes, play or participate in various forms of recreation. I think those could either be revised or deleted as well. But for the most part, a lot of it can be adapted and is still very viable in the 21st century. As for Nightingale's philosophy, petty management, continuity of care is definitely super important to me. Building trust and communication with the patient is super important, and learning everything you can about the patient in that short amount of time is vital to me in terms of learning my patient's needs, wants, anything that could go wrong, can go wrong kind of thing. And then also noise control is super important to me. As I had stated earlier, being able to provide rest for a patient is one of the necessary things in terms of helping them to sleep and revitalize themselves. And then also a variety of activities help keep the mental faculties, will prevent patient complacency and depression. I definitely find that is true. A lot of my patients get super bored while they're just watching TV, especially the bed rest patients for a day or two. Post-operatively, when they have a TURP done, it's just we want them to develop a clot, but it's at the same time the patients usually forget to bring any kind of crossword or anything like that to keep their mind occupied. And then also generalized cleanliness, keeping the room tidy, helps prevent infection, fall hazards. Keeping the patient clean helps prevent infection, decrease pain, and also assists with the patient relaxation generally. And those are my works cited. Thank you everyone, and I look forward to reading your projects.